Okay, I'm going to call the meeting to order. It is 6:02, and I'm going to ask everybody to please rise for the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Okay, Nick, can you please read the mission statement?
I can. Our mission, Macomb County Community Mental Health, guided by the values, strengths, and informed choices of the people we serve, provides quality services which promote recovery, community participation, self-sufficiency, and independence.
Thanks, Nick. Item number 3, I'll take a motion to adopt the agenda.
So moved. Support.
All in favor?
Aye.
Any opposed? Okay, item number 4, hearing of the public. Is there anyone from the public that would like to address this board? Going once, going twice. There will be another hearing of the public at the end of the meeting as well. Okay, item 5A, I'll take a motion requesting approval to move to CMH full board for final approval, approve AEDs needed at 4 MCCMH locations.
So moved.
And Tracy?
Actually, it would be Mr. Jeff Clark.
Oh,
He's the
there we
one who
go.
wrote it up and is the expert.
Do you have questions?
Yes.
Okay. Oh.
Does anybody have questions? Do you want to just give us a quick overview?
Okay, yeah, so, our current training department, the current CPR and first aid instructor has been teaching with AED trainers since 2016. We currently have AEDs in 2 locations that are county-owned. That's where our children's department is located, and then the East Clinic. Since both those buildings are county-owned, there is the Phillips that I had requested, because that's what the county is currently using, and it's nice to try to keep that across the board in case somebody does have a medical emergency. They are almost identical to the trainers that we've been using since 2016. Again, if you had a chance to read what I had written as a supporting document for that, about 70% of people that have a cardiac event require defibrillation to be saved. So if there's ever a cardiac event, you know, just the fact of having that available gives that person about a 30% better chance of survival. So.
Okay, thank you. Does anybody have any questions?
Just,
Go ahead, Nick.
just one quick, it's obviously a good idea. How many people will be trained?
Currently, everybody that is like peer support, case manager, registered nurse, even the secretaries at all the locations are already trained in using these, and they are retrained every 2 years.
Okay, so they just need the equipment, they can't
Yes.
use it, obviously.
Yes.
And then they are monitored monthly, the machines, if I read correctly?
So the machines will be monitored, actually, they take batteries, and they'll be checked on quarterly.
Oh, okay,
Yeah.
thank you.
There is monthly maintenance in case, like, if one's
Oh,
used,
there's
we'll have to
monthly
replace all the
maintenance
stuff.
and
Yeah.
Gotcha.
You good, Nick? Okay, any other questions? I have a motion and support. All in favor?
Aye.
Any opposed? Okay, thank you.
Thank you.
Item 5B, I'll take a motion requesting approval to move to CMH full board for final approval. Approved to increase the per diem rate to $75 for oversight policy board members.
So moved. Support.
Dave, is this you?
Yeah, we have a required oversight advisory board for our substance use services. And in conversation with Helen, our substance use director, her board had not had any stipend increases for quite a number of years. So we looked into it. We did the annual funding impact of that. And what we're recommending is in keeping with the current standard policies. I was trying to find the detailed email on that. There had been a question from the board member, and I did look into it, and it was acceptable. I just, I'll have more detail at the full board meeting if there's any questions about that. But it's, yeah, it's not excessive by any means.
Okay. Any questions on that?
I have a question. I don't know if it's really regarding the increase, but with the oversight board, why do they never come here and report out to us what's going on the Macosa side? You know, shouldn't we kind of know what's going on?
We can. Yeah, we could add that to the schedule, especially for this committee on the program side. Be happy to.
Okay. Thanks, Mark. That's a good idea. All right. Any other questions or comments? I have a motion and support. All in favor?
Aye.
Any opposed? Okay, item 5C, requesting approval to move to CMH full board for final approval. Approve RFI from marketing PR firm not to exceed the amount of $50,000. I'll take a motion.
So moved. Support.
Okay, Dave, is this you again?
Yes, thank you. We have been very focused on our messaging to our community members. We are completing the community needs assessment. We've done quite a bit of marketing and outreach to our community, and thank you all for approving what's been done up to this point. In doing some future planning, I thought it would be very appropriate to have the outside assistance really look at our marketing, look at our social media content, look at some of the video content that we're able to use in a number of different platforms and sources, and to really get a detailed marketing plan in place based on that type of information. When I started to look into it, it's tricky because in order for the agencies to really know who we are, what we have to offer, first thing, what we have to offer is a very lengthy conversation with anybody once you start down that road. So it's really unfair to ask somebody to develop that full scope of work without them putting some time and effort and resources into it up front. So in talking to TJ, who's does a lot of our purchasing, the new twist was an RFI with a not to exceed amount. So this would allow us to get this out into the community, get some respondents, and then choose the appropriate respondent, and then fund some of those upfront services not to exceed that amount. And then they would bring back, we would bring back a detailed plan with the future dollar amounts attached to that for the board review.
Okay, any questions? I have a motion and support. All in favor?
Aye.
Any opposed? Okay, item 5D, requesting a, oh, I lost my spot for a minute. Okay, we're good. 5D, requesting approval to move to CMH full board for final approval. Approve RFP for crisis stabilization unit. I'll take a motion.
So moved. Motion. Support.
Okay, Dave?
Thank you. We, with the board approval, issued the jail diversion RFP, and then we've been working closely with the Office of the County Executive, the Health Department, Community Corrections, Macomb Community Action as well, on some crisis continuum plans in conjunction with the opioid settlement dollars coming into Macomb County, some of the ARPA dollars, in addition to the other regular funding sources that we have. So I've toured the JJC a number of times, the Juvenile Justice Center. It presents a lot of very interesting opportunities. And we're having all these conversations. I'm talking to folks at the Michigan Department of Health and Human Services. And then it hits me that, you know, I never did issue the core part of that, which is the crisis stabilization part. So I've been describing it as a hub and spokes. The hub is this service. So what we're looking to do is see what vendors are available out in the community to operate a 24/7 crisis stabilization unit, which would then be the gatekeeper to the other diversionary services like the jail diversion, partial hospital, all the other components of that continuum that we're putting a lot of time and effort into. The goal of all of these things, of course, is to keep people stable in the community as much as possible, keep people out of the local emergency departments who don't need to be there and could benefit from other opportunities. We also have the engagement center, which I had a meeting about today, and the board approved previously and things like that. So this is an important part of the crisis continuum for Macomb County. And again, the location is not known. We are working I have invited members from the staff from the Michigan Department of Health and Human Services leadership to come out and talk to us. There's specific money in the state budget for crisis stabilization services, and I'm part of those discussions now at the state level about where those will be set up and things like that. So that's what we're hoping to see what's available to us and then help us in our planning process.
Okay, thanks, Dave. Any questions or comments?
Yes, I have one. Dave, I just have a question now. Is this crisis stabilization unit going to be separate from the engagement center? Are these going to be two different locations, or are they both in one?
Well, since the location for both of those has not been determined,
Right.
I can't answer that. We are open to them being very close together, co-located, but separate. Of course, they're different models. The crisis stabilization services will be very clinical. There will be psychiatrists, nurses, master's level clinicians. The engagement center is set up to be very non-clinical, warm and welcoming, peer-driven, and things like that. So we'll make sure that they're separate, but there's a lot of benefit to them being close together when it comes to the medical coverages and things like that.
Okay, any other questions or comments? I have a motion and support. All in favor?
Aye.
Any opposed? Okay, item 5E, requesting approval to move to CMH full board for final approval. Approve network and audio visual cabling for the training office. I'll take a motion.
So moved.
Support.
Okay, Thomas, looks like you're up.
Hi, everybody. It's been a bit. Yeah, so we have been looking at improvements to the training office over at 15 Mile, and in the process of that, this is kind of a two-pronged thing. I'll probably be back here asking you for more things. But the initial phase of this is filling some of the gaps that we have in cabling over there for the audio-visual stuff that we want to do. To kind of give you an idea of the way that things are over at the training center right now, it's not wired for any kind of audio. We don't have wireless microphones. In the past we've had, legislators or hackle at in the large multi-purpose room there that we hold our community events or staff events in, and that room has zero cabling whatsoever. And that was a choice that was made when that building was planned. And we just want to make sure that we kind of fill that in before we start to roll out any of this equipment. So again, yeah, we just have a lot of training rooms and things over there that are in sore need of cabling that weren't cabled when that building was moved into.
Okay. Any questions? Go ahead, Donna.
When I read the background on this, it talks about the training office, and then it also talks about also connectivity to other training rooms and multiple-purpose rooms. So I'm wondering if the current amount that's quoted is just for the training room?
This is for the entirety of the training office.
So
So
all the other.
all of those multi-purpose rooms, all of those.
So everything-
yeah, this is the office as a whole. So that the entire facility that constitutes the training office, which is a good probably quarter of that building.
But it says our proposal is to outfit all training rooms.
Correct.
And the multipurpose room. So it encompasses everything that's mentioned in the background material.
Correct.
Okay. That's what I wanted to know. Thank you.
Yeah, the only thing that's not included in here is the actual screens and conferencing equipment that are going to go in place after this cabling is finished. And we didn't want to bring it all to the board at once because we may end up scaling back some of this as we start to cable.
So
We
everything
kind of
is at the
overshoot it.
15-mile road location?
Correct.
Okay.
Correct.
That's no other locations throughout CMH? Okay, thank you.
Anything else?
Okay, any other questions or comments? Okay, I have a motion and support. All in favor?
Aye.
Any opposed? Okay, item 5F, requesting approval to move to CMH full board for final approval. Approve purchase over procurement limit for Lenovo docks to be distributed to remaining office spaces at CMH sites. I'll take a motion.
So moved. Support.
Okay, Thomas, this is you again.
Yep, I'm up here for this one and the next one. When it rains, it pours. Yeah, so we have essentially as a workforce, and as you know, because I came to get this approved as part of the CARES grant when the pandemic first happened, we are primarily laptop based, and we have a few sites that just don't have the docks that they need yet to fully support that approach. The Children's Department of Herculean is primarily who's going to be using this, and then as I put in the background, some of those are going to be held on to for replacements for things that break, and yeah, that's basically it. This is just more of the same equipment that we have already.
Any questions or comments on this? Okay, I have a motion and support. All in favor?
Aye.
Any opposed? Okay, item 5G, requesting approval to move to CMH full board for final approval. Approve updated Zoom contract to active host model for up to 300 users. I'll take a motion.
So moved.
Support.
Okay, Thomas, still you.
Yeah, and so this comes out of a plan that we have thought about for a while. We initially rolled out a solution that we came to you guys to get approved, I want to say about 2 years ago now, for Doximity, and that was upon the recommendation of some of our clinicians and doctors to have something that was a little bit more clinically focused. We've run into a lot of issues with connectivity with that product, and often it seems to be of the nature that we just can't do anything with technically. It could be, we haven't identified anything on our end, so it's often on the recipient's end, and we can't do anything about that. We don't get much visibility into it. It's kind of a black box for us. We use as a primary telehealth platform now Teams, but for some people that's not as accessible of a platform. And when we had discussed this amongst leadership and amongst the clinical staff, we kind of came to the conclusion that the only way that we can roll out a second solution is kind of making sure that we have coverage for everybody who could possibly be using that solution. So we don't want somebody to log into Teams and be like, hey, IT, we need a Zoom license added. We just wanted that to be available for them as an alternative. Because ultimately, like if somebody is in one of those telehealth appointments and they need to get connected to somebody, we don't care what platform they use. We just want to make sure that they can get connected. So if Teams is having an issue one day, having a second platform for them to conduct those telehealth appointments is important to us because we don't want that to just that appointment not to happen because there's not something there. So we don't feel comfortable with completely stepping away from having a second platform whatsoever. And that's why we're coming with the intention of not renewing the Doximity contract next year, which I believe is $25,000. This comes in above that, but we have more flexibility in here to kind of right size it. If we establish after a year that, you know, we only have 50 staff that are ever using the Zoom licenses, then we can shrink that contract down.
Oh, go ahead, Lori.
As somebody who tries to log in monthly with my caseworker using Doximity, and for the last 2.5 years has not been able to do it at all, and we usually end up FaceTiming because it's the only way, you know, outside of when she does come into the house. But I think that has been, even with some of his doctor's appointments, that has been the hardest thing for us to overcome as somebody whose son uses it. And when Zoom is so much that he can do Zoom himself, even at his day programs, he knows how to do that. But I'm so glad to hear this, because as somebody that has to sit there once a month with our caseworker, sometimes twice a month, this is going to be so much easier because more people do and understand to hit the Zoom than to try to go through the Doximity, which I have not been able to do, like I said, for 2.5 years.
Yeah, and as I stated, that was kind of the intention behind this. And when we originally looked at Doximity, it was upon the recommendation of our clinicians, which we found out later they were mostly using it for audio. They weren't trying to use it for video. They were kind of using it because you could, you know, say you were calling from somewhere, that there wasn't kind of all inclusive of what we had intended on using it
Right,
for.
and you want that face-to-face.
Yeah, and on the IT end, you know,
Right.
we're looking at it as, okay, we at least need something that we can have visibility into. Like, we can see what's going wrong, where you don't want to offload that to a third party. I want to be able to say, okay, somebody submits a ticket and says, you know, my Zoom isn't working or my Teams isn't working. I can go in, I can drill down to that call level and look at it and say, okay, this is why it's not working. Or it was on the recipient's end, it was on our end. Whereas with Doximity, we don't have any of that. Right. So we never have, we don't have that level of visibility. And when we had originally looked at Doximity, we were also looking at Zoom at the same time, and we picked Doximity upon the recommendation of others, and are now doing kind of what we had originally intended on doing. Yeah, me as well.
Okay, Megan?
I was just gonna ask, is it the good Zoom where you don't get kicked off after like 40 minutes? It's the, it's the paid one, so it can be as long as you want.
Yeah,
Okay,
when you pay for Zoom, that's
Thank
the
you.
difference here, because we could do free Zoom,
Right.
And that's an option, but you don't get HIPAA, you don't get
Sure.
protection for HIPAA, you know, you don't have a business associate
Not
agreement,
unlimited,
and you
sure.
get kicked out after 40 minutes. So
Thank
yeah,
you.
not an option for us.
Who else had?
Yeah, I think you just answered my question. I've done some telemedicine with doctors that I work with and through the pandemic, and they've had like separate programs because of HIPAA and other privacy concerns. Zoom incorporates that in this?
Yeah, as does Teams. So when it comes to HIPAA, essentially what you need to establish with any company that you're doing business with is a business associate agreement that's inclusive of the data protections that they're going to put in place.
I know, but I know the doctors I dealt with were also concerned about, you know, who could log in or who could hack in to the discussion. Does Zoom have those protections? Because that's like Henry Ford Hospital has their own system, and they call me, and other doctors, they call me or I call them. It's a totally separate thing that
and
somehow hacked. I like Zoom because I know how to use that one because I've used it a lot through the last couple of years. But in the early days of telemedicine, there was a great deal of concern about security, not just between the doctor agreeing with us, but, you know, somebody getting into the system.
Yeah, and so what we're rolling out is Zoom for healthcare, and it's essentially, it is Zoom,
Gotcha.
but what it does is you have a baseline set of policies that conform with HIPAA. And so if you do need to peel somebody off of that group, that's like, let's say Dave. Dave's not going to be conducting clinical, like private meetings, that he may need a more lenient policy where he can allow anybody on this board into a meeting or something like that. But that a doctor is going to be in a set of policies that are associated around HIPAA law. So there's going to be certain things that they can't do. They can't just, run a meeting without a passcode. They can't say, okay, anybody with the link can come to this meeting. There's additional stricter policy that has to go into place.
And the patient or the consumer or the recipient has to sign off certain agreements to.
So we sign off an agreement with the company providing it, and this is both on the with Teams right now, and we did it with Doximity, and we do it with Zoom, and we sign that business associate agreement that covers us for HIPAA, and then on top of that, there are requirements in HIPAA, and high tech is the other law that require us to conform to privacy restrictions related to HIPAA.
Yeah, I guess, I had to, as the patient, when dealing with the doctor, fill some form.
Oh yeah, we do that in the medical record. So
Okay,
there is
that's
there is a consent to conduct telehealth appointments
Gotcha.
and all of that. Yeah.
Gotcha. Okay, thank you.
Any other questions or comments? I have a question. Do we pay for Teams too?
That's inclusive of our full kind of Microsoft 365 licensing. And so, yeah, that's part and parcel. So we basically pay a discounted rate for it. But it is, it's something we already pay for, I guess you would say. That all of the other services that we require and different security things that we get as part of that plan that we're able to roll out and make policies for also includes Teams. So
Okay.
it's something that's already in place. The Zoom would be more of that Doximity component, where it's a little bit more specialized and it's available there as a second option. But we have the same kind of privacy protections in place for Teams that we do for, or would for Zoom.
Go ahead, Donna.
So when will the update take place? When will the changeover from Doximity go to Zoom?
So if we get this approved,
Yes.
we plan on rolling it out as soon as the ink dries. So we would, as far as from the perspective of the employees and staff, yeah, right. Yeah, and that would be the idea, is that we still have some months left on the Doximity contract. Like, we paid it up front. Once that expires, we don't plan on renewing it. There's enough time left in that contract. I think we're looking at about 7 months right now, where there's time for the people that are using Doximity to get off of it and onto Zoom or onto Teams. Yeah, but it'll be available, like I said, as soon as we're able to kind of sign off on the purchase order and get that purchased, those licenses will be available to use, and we will make sure to communicate that. Yep.
Okay. Any other questions or comments? I have a motion and support. All in favor? Aye. Any opposed? Okay, thank you, Thomas.
Thank you.
All right, agenda item 6, receive and file. I don't believe we have anything. Item number 7, resolutions. I don't believe we have anything. Item number 8, other possible agenda items. 8A is a CEO update.
I thought I'd have Thomas do the CEO update. Just keep him up at the podium for the entire. Actually, it's my pleasure to introduce to the board the newest member of our leadership team, Tony Gaglio. He's our new finance director. He's hit the ground running. He's on day 2. So Tony, if you could come to the podium and introduce yourself, please.
Good evening. Thanks for taking a few minutes to allow me to introduce myself. I'll just go through personal, professional, and then a little bit of my experience just to let you know a little bit of who I am. So personally, pretty much lifelong resident of Macomb County, other than just about 6 years. I was down in Houston working at a psychiatric hospital. But other than that, I've Been here in Macomb County, married. We're raising 4 kids, all of them in college right now. That's on the home front. Professionally, I am a certified public accountant. My undergrad is from Walsh College in accounting, and I have a master's or an MBA from the University of Detroit Mercy. From an experience perspective, most of my experience is not-for-profit healthcare. I've worked with many of the local hospitals and health systems when I was in a public accounting role, but then I actually worked in the corporate office for Trinity Health, financial analyst, auditing, all of those respective things. Also worked at Henry Ford Health System, and that's where I transitioned to behavioral health. So in 2010, I had the opportunity to work at One Ford Place, and I was the finance leader for all of behavioral health. So really gained a good understanding of inpatient psychiatric care, outpatient, but also making that connection of this is an issue or an illness that affects all of us, right? We all have loved ones, family members, friends that struggle. So I really found my passion there. I was at Henry Ford for about 5 years, and then I had an opportunity to interview for this chief financial officer for what's called the Menninger Clinic in Houston, Texas. And after visiting and interviewing, I just knew that was the place to be. If you ever read the story about the Menninger Clinic, you'll see why. If you're going to be in mental health, that's the place to be. So I spent about 5 years working there in the capacity of CFO and actually as the interim CEO for almost 2 years. Then the opportunity came back to come back to Michigan. As soon as I opened that door, my wife is like, so we're moving back to Michigan, right? And so here I am. I did a short stint with hospice work, but my real passion is mental health, and just thankful that this opportunity came about. And a little different side of mental health, but I'm hoping that all the experience and the things that I've learned can be applicable to what we do here and serve this community, because as you all know, because this is what you do, there's a tremendous need, and we're just part of fulfilling that need. So that's a cliff note about myself. If there's a question I can answer. No. Thank you.
Welcome, thank you. Did anybody
Yeah,
have any questions before we let him go? Okay.
It
Thank
was
you.
a 2.5-year search. And then I just wanted to pass it over to Tracy for some updates on the more positive, well, not more positive, we had Tony, which was continuing the positive streak here, passing it over to Tracy.
Yes, we don't always get to talk about the fun stuff, so I just want to bring to your attention 2 quick items. You will see them in last week's workforce update and today's workforce update, but I wanted to kind of give you some insight. One of them is our care closet. We have amazing staff, and here's what they were doing. At each site, someone comes in and maybe they've urinated on themselves, or maybe they're having something that they don't have a coat and it's, below 0 outside. They were taking upon themselves and creating kind of little mini clothes closets in a box and doing an amazing job at it. But we want to get that a little bit more organized. So at each site we're opening, and this is all due to the staff's great ideas and efforts, a care closet. And the concept that at each site, imagine you would have like actual coat racks, not things in boxes, right? And making sure we had the basics. Sweatshirt, sweatpants. We're not going to wardrobe anybody, right? We're talking about the example I gave you, an emergency situation. We want to be a solution for today. We're not going to be your clothing solution for tomorrow, right? But we're here for you today. So the reason why we call it a care closet is we want those basics of clothes, coat, gloves, hats. But then also, again, we're not your food bank, but if you don't have food today, we're going to make sure you have some non-perishables for today. And then we're going to make sure we're going to connect you with the food bank. Other things, hygiene products, right? Again, we can't be your hygiene project for the rest of the week, but let's at least get you some to make you through until we can get you connected with the right resource. I explain it in that way because we can't be the solution for all things, but imagine it would be a room that we would take people in, try to make it as organized, friendly, welcoming as possible, so they feel empowered where they can pick some items and it be a positive experience for them. So we are accepting donations, but we are going to target very specifically what we're going to put in those care closets. Anything that maybe is not quite to that, we do donate to Liberties. So anything that's donated will still go to great use. We're accepting donations the week of October the 24th. The next, and it kind of culminates on October the 27th, and that relates to the next good news. If you didn't notice it, and on Thursday, October the 27th, we are having our second annual fall, did we call it extravaganza? I forget what we called it. We had a fancy name, but I don't remember it.
Like Fall Fun Festival or something.
Yes, it was, see, it was a cool name. So essentially, it is, all of you guys are welcome and we'd love to see you, but what it's going to be, beginning at 6 o'clock, we're doing a trunk or treat, and if you don't have kids, that doesn't mean you don't have to come. So as an example, you're welcome to hang out at my trunk. We do have a trunk or treat contest in addition to giving out candy to anybody's there. We also have a costume contest for adults, a costume contest for kids, and then we are also giving out at that event what we call the Smiley Awards. If you remember last year we did it. Essentially, we recognized 3 staff for exhibiting and doing the best on the Happy or Not. Anybody who's newer, Happy or Not is a survey system that's available for anybody at any time electronically or in person when they're at the site to say, I'm happy with the services, I'm not happy with the services. So acknowledging the good feedback that we've gotten of at least 3 team members. We also do a Smiley Site Award. Last year, Crossroads won it, so they're very competitive. And they want to win it again, but they actually get a trophy with their little, name on it or whatever. So the reason why I'm relating those two is at that event, you're also welcome to bring donations because we're going to accept those. Other types of donations that we're not going to use for the care closet, but we are going to use for our homeless initiatives with Connie, are if you want to donate any like fast food gift cards, like in small amounts. What Connie does, if you don't know, she's amazing. She goes where the people are. She goes under the bridges. She goes wherever the person is, and imagine when she gets there, she wants to be able to feed them if that's what they do. She wants to give them a coat, but she can only fit so much in her trunk. So that's why the gift cards are great. She'll physically take them to Burger King or whatever they need to do. The last thing is you have the opportunity to give somebody a home, and here's how you can do it. Connie is wanting tents. So what happens is she goes out and meets people and they're homeless, and yes, the goal is not for them to live outside, but there are circumstances that is their situation. So if you have a tent that is gently used or new and you want to donate them, please bring them the week of the 24th or on the event of the 27th. And you, again, have the opportunity to literally give somebody a home, which makes a huge difference in their situation. So see, I got to do all the positive stuff.
We're going to have Tracy do good news updates.
Yes. What'd you say? That event is at administration, but all the sites are collecting donations if you're interested. Yes, and we would, again, love to see you. You're welcome to come. So if you notice, I give you the timeline. If you only want to come for the trick or treat and get the candy, you can do that and then leave. I forgot to do the most important part, the movie, right? I just got so excited about the trick or treat. So at 7 o'clock, we are doing a drive-in movie. That's kind of the main event, and it's Hocus Pocus 2. If you don't know that, it's brand new, if you haven't seen it. And it's out on this big, huge screen. You park your car. We will provide snacks for you while you're there in addition to all the candy. Did I miss anything, Thomas?
I don't think so.
6 o'clock is trunk or treat. From 6 to 7 is trunk or treat, costume contest, Smiley Awards. At 7 o'clock, as long as it's dark, we're trying to judge darkness. We're going to start the movie event. So the greatest part about it is for you younger kids, you could just show up from 6 to 7. You could show up from 6:30 to 7. You could show up for just the movie, whichever you want. And we're very excited if you aren't picking up on that. At administration, so 19800 Hall Road. Yep. And you are welcome to bring family or close friends. It's not a necessarily completely closed event.
Thank you, Tracy. I'll save my more formal comments for the full board meeting and let it go at that. Thank you. She's a tough act to follow.
Take that off the agenda.
Okay. Thank you, Tracy. We've got a couple of reminders for you guys. There's a recipient rights committee meeting Thursday, October 20th at 8 a.m. at the administration building. And then our full board meeting is Wednesday, October 26th at 6 p.m. And that takes us to item number 9, hearing of the public. Is there anyone that would like to address the board?
I got one more thing that was in the workforce updates. If you haven't had your flu shot yet, Genoa Pharmacy is going to be at the west location tomorrow from 12 to 2 p.m. So just bring your insurance card. If you don't have insurance, they have options for you there too, where they're providing the flu shot to people that don't have insurance. So just show up from 12 to 2 and meet with Genoa representative to fill out some paperwork and get your flu shot.
Okay, perfect. Thank you. Anyone else from the public? Going once, going twice. Okay, item number 10, I'll take a motion to adjourn. All in favor? All right, good meeting, guys.